I remember sitting in Mum's office because I couldn't go to school. I was that sick. I was laying down on a bed at Mum's work to the point where I just, I couldn't stay up. I was that out of it.
Tanner McMillan was a live wire 10-year-old when he was bitten by a tick in country Victoria. Ticks are widespread in Australia, but particularly common along our east coast.
You've got a child who was fully functioning, had so much life about him, and, you know, at one stage there, Tanner had completely given up and didn't want to live anymore.
Over a year, Tanner saw countless doctors and spent weeks in a large public hospital to no avail.
I remember sitting in my bed and a psychologist come through the door. She kind of basically told me, in other words, to pull my head in, that it's psychological, it's actually in your head. You need to work it out. Meanwhile, I'm having seizures and passing out every day.
He had no previous history of any psych issues at all. We just felt at that stage we were lost. He would walk into doctors and they'd basically pat him on the head and we'd walk out in the same state he went in.
The family asked for Tanner to be tested for tick-borne infection, but say that was refused.
As Tanner used to say, everyone that was supposed to care dismissed him.
Eventually, the Lyme Association put them in touch with one of the few Australian doctors who acknowledges the disease. And Tanner's blood was sent to Germany for testing. The result was positive.
We had some answers as to what we had to tackle.
The disease was first discovered in the 1970s in the Connecticut town of Lyme. While not all ticks carry the bacteria, and not everyone who's exposed to it will become sick, it's now the fastest growing insect-borne disease in the US.
So there's a lot of cousins and strains of Lyme, but essentially it's a bacterial infection where people just are really ill. It's kind of like syphilis.
New York-based Dr. Richard Horowitz has studied and treated Lyme disease for 35 years.
A lot of times, if you get the rash early and you treat it, 75% of those people will be well for the rest of their lives. No problem. Lyme is truly an epidemic that's worldwide, but the Australian government has not recognized it there.
You know, the symptoms were just soul-destroying, basically. They're paralyzing. They left me bedridden a lot of time. I sometimes didn't recognize my partner. I knew her, but I couldn't remember her name.
Canadian-born Sharon Whiteman has spent the last 20 years living with the disease and fighting for authorities to take her seriously. She was bitten by a tick north of Brisbane.
I've been told I've been depressed. I've been told I overate and I was lazy. I've been told that I had an autoimmune disease.
Once again, blood tests overseas showed she had Lyme, but all her doctors refused to believe it.
The ophthalmologist comes into the room and he goes, "Hi, my name," shakes my hand, "my name is Dr. X, and there's no Lyme disease in Australia." Hadn't said a word to me, that was it.
Most Australian doctors don't dispute the existence of Lyme disease, but say there's no evidence it's responsible for chronic effects. The doubters believe that doctors who do treat patients for chronic Lyme disease are putting them in danger by ignoring other possible causes. So in any event, more and more doctors are shying away from treating it.
Any of the doctors that are experienced that are still treating, our books are closed. They're overwhelmed with demand.
Tanner's doctor wouldn't talk to us for fear of repercussions, but the teenager says he owes him his life.
When I was little, I was always doing sport. I was the fittest kid, and now I'm slowly getting back there. I'm not back there fully, but I'm still fitter than what I was. But yeah, it's huge.
We reached out to medical authorities, but they declined to be interviewed. They say they're prioritising patients' safety, but not everyone sees it that way.
The medical profession's position on Lyme disease and Lyme-like diseases and symptoms is completely inexplicable to me.
Senator Linda Reynolds was part of a Senate inquiry into Lyme disease 7 years ago, which received 1,300 submissions.
People here are in tears. They were shaking their heads.
I know and I understand the concerns that they have. I've heard them. But, Senator, we have to go with where the evidence is.
The inquiry found that complex emerging diseases require treatment even in the absence of definitive research.
It was clear to me and to the committee that we have many thousands of people who are genuinely chronically ill and in pain, and the medical profession just treats them as if they've got a mental illness. Sadly, since the inquiry reported in 2016, I think the situation has gone backwards.
I had a suicide plan at one point. You know, it's like torture. And the government is failing us, and the government needs to change now.
You had heart just breaks for these people, right? Imagine having this problem, going to doctors and essentially being gaslit by the medical community saying, actually, it doesn't exist here, we can't help you. And the most galling part is that this is actually a curable disease. In places where they do treat Lyme disease, all it takes is a 6-week course of antibiotics and then you don't have these lingering, debilitating symptoms. So something needs to be done pretty soon.
Well, there's lots of parts of Australia that have a tick problem. I mean, Northern
All
Beaches
down
in
the
Sydney,
coast.
really bad.
Everywhere.
But surely the medical fraternity wouldn't be so confident there's no Lyme disease for no reason, right?
No.
I find it hard to believe they would just go,
I find
we're just going to, like...
Their reluctance to identify, to accept it seems odd.
But no, but maybe, I mean, you saw the Senate inquiry, they're saying we'll follow the evidence. If they don't think, it's not, I can't judge this, right? But if they don't think that, then what can you do? Like, we did this story, I reckon, on this show probably, I don't know, 3 years ago, 5 years ago. It hasn't changed in the intervening period. I don't know how you break this.
You just feel sorry for that little boy.
So sorry for him. I mean, clearly he was affected.
Yeah.
And to be told that it was just depression, to pull his head in, horrible stuff.
Yeah.
If this story has raised any issues for you, you can always contact Lifeline on 13 11 14.